So, refractive lens exchange. This is where you have a refractive error. Now, refractive error means that you're long or short-sighted, or you have astigmatism. That means that your vision without spectacles on is blurry, and that drives you crazy because you've got to wear spectacles or contact lenses. Now, that's not a big deal wearing spectacles or contact lenses, and a lot of people do that, and they look great. You can get your designer spectacles and look fantastic, but some people it frustrates them. One of the things that really bugs people are the younger people who suddenly become presbyopic, which is where you can't see close up. And so we sometimes do refractive lens exchange on people. Refractive lens exchange is effectively cataract surgery without the cataract. So cataract means your lens has gone cloudy. In these circumstances, the lens is not cloudy, it's clear, but we still remove it in order to achieve an outcome for your spectacle power. And that means we can take away your long or short-sightedness, take away your astigmatism and set you for distance. It gets more complicated when we try and set you for distance and near, because the light is focused only onto one point with the standard lenses, so we have to do something clever to try and give you that distance and near vision. Nothing is as good as when you were 18 and you could see in the distance and close up. And there is another talk about presbyopia which explains exactly what's going on. So it's well worth accessing that video. So there are strategies that we can have in order to sort things out, but refractive lens exchange is really cataract surgery without the cataract itself. The downside is that usually these people have clear lenses, so with appropriate contact lenses or appropriate spectacle correction, their vision is good. So if we fiddle around with you and we don't achieve that same standard of vision, you'll be unhappy. If heaven forbid something goes wrong surgically and you get a complication, you'll be unhappy. And so it's really important to realise it's effectively a cosmetic procedure. And you know, there are things that can go wrong. You may not always be happy. So just because you're coming privately doesn't mean that throwing money at something will achieve it. And just be cautious and make sure you do your research and make sure you have an in-depth discussion with your surgeon about it. Refractive lens exchange is something that I do very frequently for younger people, but I'm always hesitant because their vision is quite good with appropriate correction. So sometimes they end up less than overjoyed by it. If you imagine the older patient who's got a decent dense cataract, they're delighted with anything, whereas these younger patients, potentially the 45-year-olds, 46-year-olds, they don't tend to do as well because they were used to good vision with appropriate contact lenses, and then sometimes I can't achieve that high standard.